morning and welcome to Dementia Action Alliance Professional Insights Podcast. My name is Laurie Scher, and today I have the honor of being able to talk with Howard Gleckman regarding Medicare and the whole process. Howard Gleckman is a senior fellow at the Urban Institute and author of the book Caring for Our Parents. He's also a columnist on aging issues for Forbes.com and serves on the boards of the Jewish Council for the Aging of Greater Washington, Suburban Hospital in Bethesda, Maryland, and Johns Hopkins Medicine. Howard, welcome and thank you so much for coming on today.
Well, it's great to be with you, Laurie.
Howard, boy, I'll tell you, I just went through this Medicare process and it's a bear. It's horrible. Why is it important to enroll in Medicare as soon as you can? What's the importance of that?
So Medicare is a great program. It really is. And it's very important for older adults and for people with disabilities, but it's very complicated. And the first thing you need to know is what the enrollment period is like. And when you turn 65, or just before you turn 65, you should be getting a notice from Medicare telling you that you're about to turn 65 and you're eligible. You need to enroll both in Part A and you might have to enroll in Part B. Part A is hospital insurance. Part B is the insurance that covers you for doctor visits and tests and that sort of thing. The way it works is if you're already getting Social Security benefits, you'll automatically be enrolled in Part A and Part B. But it gets complicated because if you're not taking your Social Security yet, you're not automatically enrolled. You have to do it yourself. That means you have to go on the Social Security Administration website and sign up for Part A. And then where it gets complicated is what happens with Part B. If you don't enroll in Part B when you are first eligible, you actually begin to incur penalties. And the longer you wait, the bigger those penalties are. So your premiums actually go higher and higher if you don't enroll when you're first eligible. So the other thing you need to know about that is not everybody is first eligible when they turn 65. If you have, say you're still working, you may have insurance from your employer. If your spouse is still working, you may have insurance from your employer's spouse. So in that case, you don't have to enroll in Part B. You still have to enroll in Part A, but you don't need to enroll in Part B until you no longer have private insurance. And once you no longer have private insurance, then the clock starts running and you have to enroll in Part B or you start paying those penalties. So that's the really complicated story of when you first enroll.
Yeah, I know that was a very complicated process, and even trying to then decide, okay, now which do I go with, A through Z or double A, or what is going to be good for me? What is the difference between traditional Medicare and Medicare Advantage?
So think of it as two separate tracks. So the one track is the traditional Medicare program, and that's the one we're mostly familiar with. You buy you get your Medicare insurance, and you go to whatever doctor you want who takes Medicare. If you go that route, Medicare Part A and Part B is not going to cover very much of your health care. So you also need to buy a Part D drug benefit, which is separate. And you probably, as long as you can afford it, want to buy what's known as a Medigap or a Medicare supplemental insurance policy. And that's the one with all the letters. And what they do is it's A through N, and you have to pick one of those. You go on the Medicare website and it will show you all of the insurance companies that offer that letter plan in your community. All of the benefits in each of those plans, in each letter is identical. So all the A benefits are the same, whichever insurance company you use, or all of coverage in, say, D is the same, or E is the same, no matter which insurance company you use. What is different is the price. The premiums can be very different from insurance company to insurance company. And the other thing that's very different is the networks. Some insurance companies may take some doctors and others may take other doctors. So if you have a group of physicians who you use a lot, particularly if you have a chronic condition, you need to be sure that that Medigap policy, that Medicare supplemental policy, actually covers those doctors that you like to use. So that's one track. You pick up with the original Medicare, traditional Medicare, and then you buy a Part D plan, and if you can, you buy a Medicare supplemental insurance plan. The other way you can go is with something called Medicare Advantage. Sometimes they call it Part C. And Medicare Advantage is a very different program. It's a managed care program. And it will cover all of your needs. It will cover your drug benefit. It might pick up your benefits for eyeglasses or for even dental sometimes. So it's a very comprehensive benefit. It's usually less expensive than paying for Part B and a Medicare supplemental policy and a Part D policy. So it costs you less, but there's a trade-off. The trade-off is you're going to be in what they call a closed network. You're only going to be able to go to the doctors that the Medicare Advantage plan has contracted with. If you go out of network, it's going to be very, very expensive. Essentially, the insurance won't pay. You'll have to pay it all yourself. So that's the choice you have to make. Do you go down the traditional Medicare track, or do you go down the Medicare Advantage track? The other thing that's important about this is if you choose a Medicare Advantage plan and you decide after a while that Medicare Advantage isn't for you, it's not working very well, you can switch to traditional Medicare. But, and there's always a but, the problem is,
Of course.
the problem is that if you go into traditional Medicare, you may not be able to get a Medicare supplemental plan or a Medigap plan because they can underwrite you for pre-existing conditions. So if you have dementia or if you have arthritis, a Medicare supplemental plan can say, we're not going to cover you, or we're going to charge you so much money that it's going to be unaffordable. So you have to be very careful if you take the Medicare Advantage route, because it may be very hard for you to get fully comprehensive coverage if you switch back. When I should say that if you enroll in Medicare Advantage, if you enroll in Medicare Part B and try to buy a Medicare supplemental plan or a Medigap plan when you're first eligible, they do not underwrite you. So they can't take into consideration the fact that you may have dementia or you may have some other pre-existing condition. So if you do it from up front, there's no underwriting. But if you switch later on from the Medicare Advantage plan to a traditional Medicare plan with Medigap, you may be underwritten and you may not be able to afford the insurance.
Wow, I know how complicated this process was for my husband and I, because I have dementia and he has common variable immune deficiency, CVID. So he's on medication that actually costs $6,000 to $8,000 per week. He has to do infusions. So for us, the hardest part, I think, was deciding which one to go with. They couldn't give us an answer as to where his medicine would be covered, under B, C, D, whatever.
Yeah.
Initially, we went to a place called Encore, which is in our county. They offer someone you can sit with, but they recommended Plan F. Mm-hmm. And then we were told, you probably don't want to go with F because they're doing away with it. And it's a strong possibility that the price may go up. So we had to relook at it all over again. But tell me, where can I go to really get help enrolling?
Yeah, it's very hard for almost anybody to do this because it's so complicated. And one thing that you have to be especially care about are these letters. So there's Medicare Part A, Medicare Part D, Medicare Part C, Medicare Part B. Those are all the different parts of Medicare. And then there are the different plans for Medigap coverage. And those also have letters, A, B, C, D, E, F. So you can get really confused between the plan letters and the parts of Medicare letters. So that whoever designed that wasn't really thinking very wisely about this.
You know, and you add dementia to all this, it's already confusion. You add dementia. We must have sat down with this lovely woman at least 4 times because I couldn't wrap my head around it at all. So
yeah, it's very hard, and even people without dementia can't really figure this out. You know, Medicare sends out a book when you first turn 65 and then every year after they send you a book called Medicare and You. It's about 122 pages long. I don't know whether they think anybody really ever reads it, but I don't think anybody does.
I tried. Does that count?
You can go to the Medicare website. You go to medicare.gov, and they have information there. And that's a good place to go to compare plans. But if you're looking for advice, there are a couple of options. One of them is every state has what's known as a SHIP program, which is a state health insurance assistance program. And you can go there, and they have counselors, and there's no cost, and they'll talk to you about which insurance you should buy and which might be best for you. You can also go to your local AAA, your area agency on aging, and they may have people who can give you advice. The other place to go are, private counselors. You can talk to a geriatric care manager. They may be able to help you with this. Or if it's really complicated, you can always find an elder care attorney who might be able to walk you through some of the Medicare issues. Now, that gets more expensive, but it's a very important decision. And if your situation is especially complicated, it might even be worth hiring a professional to help you out. But I would start with the SHIP program, the State Health Insurance Assistance Program. You can find them in the Yellow Pages, or you can find them online, or you can call the AAA and they'll help.
SHIFT or
SHIP, like a boat, ship.
Okay.
That would be the first place I would go, and it may come under different names. Sounds like in your county it's got a little bit of a different name, but that's really what they're called. You could also get on the Medicare site, you can also get a list of contact information there. But I would either look it up in the directory or Google it, or start with the AAA, the Area Agency on Aging, and they can refer you there.
Great. This has been so informative. I wish we actually had this talk about 2 months ago before I went through all the issues that came with it, because it was really a task. I heard just yesterday that when you have Medicare, you're able to enroll in something called Silver Slippers. Do you know anything about that?
No.
It's an exercise program.
So I don't know about that specific program, but Medicare will, in some cases, cover physical therapy or things like exercise. The other thing to know that's brand new in Medicare Advantage is that for the first time in 2019, they're offering some plans are offering what they call supplemental non-medical services. And those are things like home health aides, rides to the doctor, nutrition programs, even in some cases you can get a day a week at an adult day program. It's a very interesting new program. It's being offered for the first time. Most Medicare Advantage programs are not yet offering it, but there are a few that are. And if you're thinking about Medicare Advantage, if you have dementia, this is the kind of thing that might be very helpful to you. So what I would do is at least check and see whether or not the Medicare Advantage plans in your community are offering this benefit. It's called a supplemental benefit. And then if they are, you need to see if that Medicare Advantage plan otherwise is a good deal for you. Does it cover your doctors? Does it cover your drugs? As you're saying, your husband, very important for him to make sure that whatever plan he gets covers his medications. So you need to make sure all that happens. But if covers your medications, if it covers your doctors. If you like the idea of managed care, see if the plans that are being offered in your area are offering this additional supplemental benefit. And if they are, it might be a very good thing to look at.
Wonderful information. Now, let me ask you one other question. When I was looking for Medicare, what things do I want to determine before I go to meet with somebody? What things, how do I know which plan is good? What's it based on? Just on the price?
So it's based on the price, but it's also based on, when you think about Medicare supplemental or Medigap policies, it's based on what your specific needs are. So if you look at these policies, some of them have more generous coverage for certain things than for other things. So just to take one example, a really kind of extreme example, say you travel a lot. Some Medigap plans will cover you when you're traveling and some won't. And that's particularly true if you're traveling internationally. So let's say you're somebody who lives in Vermont and you go to Canada a lot to visit relatives. In some Medicare Advantage plans, you may not be covered if you get sick while you're in Canada. In others, you will be covered. So that's the kind of specific situation. Some are more generous with their drug coverage than others. So if it's a situation like your husband where he needs a very expensive Part B drug, you want to be sure that the Medigap policy that you buy covers that Part B drug. Now, just to make it a little more complicated, the thing you
Of
have to watch
course.
out for is these plans can change their drug coverage from year to year. So you may have a situation where they cover a certain drug when you enroll, and then next year they may have a different formulary, and they may say, we're not going to cover that drug anymore, or we're going to cover it, but we're going to pay less of a benefit for it. So you have to be very careful about that too. Medicare Advantage plans can also change the benefits they offer from year to year. So you've got to be careful that you can't know what they're going to do. You make the best guess you can for the current year. And then if the plans change, you have to be prepared next year to make a change yourself.
Well, let's hope they don't stop covering the medications. That would be horrible. And what about if I move to a different state? I'm in Pennsylvania and we're thinking it's going to be a wicked winter. I mean, Florida's sounding real good right about now. Do I have to change Medicare? Is it state to state, or is it once I do a supplemental plan, will that carry with me anywhere I go?
So the way that works is, I hate to give you another complicated answer, but I'm afraid I have to. So if you just have Part B works everywhere. Part B is in boy, that works everywhere. And if you buy a Part D drug benefit, that works everywhere. So you don't have to worry about it. If you get a Medigap policy, a Medicare supplemental policy, those policies are different from state to state. And you may have to change that policy if you move. And there are provisions that allow you to do that. If you get a Medicare Advantage plan, those plans are different from state to state, and you may have to change those as well. And again, there are provisions that allow you to do that if you move. So it really depends on what coverage you have. It's something you need to check. And then where it gets more complicated is, so you move to a different state. Let's say you decide you want to go to Florida or you want to go to Arizona where it's warm. Now you've got to find out whether the doctors who you're going to use in your new state are covered by whichever plan you have. So it gets more complicated that way too. So if you buy a Medicare, just a traditional Medicare, and you get Medigap insurance too. Let's say you have United, you get your Medigap from United Health or from Aetna or from Blue Cross, any one of those. They may have really good coverage in Pennsylvania with all the doctors you really like. But if you move to Arizona, they may not have a very good network down there. And you may have to change plans.
Wow. It gets even more complicated. I guess we should just stay put where we are.
Just get another heavy coat and you'll be okay.
Yeah, a new snowblower maybe. Howard, I so much appreciate you giving up your time today. We look forward to having our discussion and opening it up for questions. I want to thank our viewers, and if you're interested, you can view more Professional Insights podcast at daanow.org, and then look under podcast. So we've had a number of really interesting interviews. So on behalf of Dementia Action Alliance, I want to thank Howard and all our viewers. Have a wonderful day.
Laurie, thank you.
We're living beyond dementia, connecting our lives to help us survive. So we live our time to the fullest. We